Question 1. Quality control measures reveal that a significant number of telehealth claims submitted by a healthcare organization are being denied due to coding and documentation discrepancies. The revenue cycle team needs to implement a corrective action plan. Which of the following approaches best addresses this issue while ensuring compliance with U.S. federal and state regulations governing telehealth reimbursement? Option A. Implement a comprehensive training program for all coding and billing staff on current Medicare and state-specific telehealth coding guidelines, modifier usage, and documentation requirements, and establish a pre-submission review process for all telehealth claims to verify compliance. Option B. Advise the IT department to prioritize the integration of new telehealth platforms and defer any immediate changes to coding and billing processes until the technology is fully stabilized. Option C. Focus on updating the organization's patient consent forms for telehealth services and assume that coding and documentation issues will be resolved through payer appeals processes. Option D. Instruct the billing team to resubmit all denied telehealth claims using the standard CPT codes for the corresponding in-person services, assuming that payers will eventually adjust their policies to align with in-person reimbursement. Correct answer is A. Implement a comprehensive training program for all coding and billing staff on current Medicare and state-specific telehealth coding guidelines, modifier usage, and documentation requirements, and establish a pre-submission review process for all telehealth claims to verify compliance. Explanation: this scenario presents a common challenge in revenue cycle management as healthcare providers increasingly adopt telehealth services. The core difficulty lies in ensuring accurate and compliant billing for these services, which often have different coding, documentation, and reimbursement rules compared to traditional in-person visits. Professionals must navigate evolving regulations, payer policies, and the technical aspects of telehealth platforms to maintain financial integrity and avoid compliance risks. The correct approach prioritizes adherence to current Medicare and relevant state-specific telehealth regulations, alongside payer contracts. This involves verifying patient eligibility, ensuring appropriate documentation for the telehealth encounter, including consent and modality, and applying the correct CPT/HCPCS codes and modifiers specific to telehealth services. This approach represents best professional practice because it directly addresses the regulatory requirements for telehealth reimbursement, minimizing the risk of claim denials, audits, and potential penalties for non-compliance. It ensures that services rendered are appropriately captured and billed according to established guidelines, safeguarding the organization's revenue stream and reputation. An incorrect approach that focuses solely on applying standard in-person visit codes without considering telehealth-specific modifiers or guidelines would lead to claim rejections or denials. This is a regulatory failure because it violates the specific billing instructions for telehealth services as outlined by Medicare and other payers. Another incorrect approach that neglects to verify patient consent for telehealth services before the encounter is an ethical and regulatory failure. Many payers and regulations require documented patient consent for telehealth, and its absence can invalidate reimbursement and expose the provider to HIPAA privacy concerns. A third incorrect approach that relies on outdated payer policies for telehealth reimbursement would also be a significant failure, as telehealth regulations and reimbursement rates are dynamic and subject to frequent changes, particularly in response to public health emergencies or legislative updates. The professional decision-making process for similar situations should involve a proactive and informed approach. Professionals should establish a robust process for staying updated on telehealth regulations from CMS and state licensing boards, as well as individual payer policies. This includes regular training for billing and coding staff, implementing clear documentation protocols for telehealth encounters, and utilizing revenue cycle management software that can accommodate telehealth-specific billing requirements. A systematic review of telehealth claims before submission, focusing on coding accuracy, documentation completeness, and payer policy adherence, is crucial. Question 2. Cost-benefit analysis shows that implementing a new suite of revenue cycle metrics will require significant investment in staff training and technology. To maximize the return on this investment and ensure compliance with healthcare regulations, which approach to metric selection is most professionally sound? Option A. Implement metrics that are easily reportable with existing technology, even if they do not fully capture the nuances of revenue cycle performance or potential compliance risks. Option B. Focus exclusively on metrics that demonstrate high transaction volumes, such as the number of claims processed daily, to showcase operational efficiency. Option C. Prioritize metrics that directly impact patient financial experience and regulatory compliance, such as denial rates, clean claim submission rates, and point-of-service collection percentages. Option D. Select a broad range of metrics covering every aspect of the revenue cycle, regardless of immediate impact or ease of measurement, to ensure comprehensive oversight. The correct answer is C. Prioritize metrics that directly impact patient financial experience and regulatory compliance, such as denial rates, clean claim submission rates, and point-of-service collection percentages. Explanation: the scenario presents a common implementation challenge in revenue cycle management, selecting the most impactful metrics for performance improvement. The professional challenge lies in balancing the desire for comprehensive data with the practical limitations of resources, staff training, and the potential for overwhelming the team with too many metrics. Careful judgment is required to identify metrics that are not only measurable, but also actionable and directly tied to strategic revenue cycle goals, while remaining compliant with relevant regulations. The correct approach represents best professional practice because it prioritizes metrics that directly influence patient financial experience and regulatory compliance, such as denial rates and point-of-service collections. These metrics are foundational to a healthy revenue cycle and are often subject to regulatory scrutiny, e.g., CMS guidelines for billing and collections. Focusing on these allows for targeted interventions that can yield significant improvements in cash flow and reduce compliance risks. This aligns with the ethical obligation to manage patient accounts responsibly and transparently, adhering to all applicable laws and guidelines. An incorrect approach that focuses solely on volume-based metrics without considering their impact on revenue or compliance is professionally unacceptable. For example, tracking only the number of claims submitted without analyzing denial rates or payment timeliness fails to identify inefficiencies or potential compliance issues. This could lead to a false sense of productivity, while revenue is being lost or compliance is being jeopardized. Such an approach could also violate ethical principles by not actively seeking to optimize the revenue cycle for the benefit of both the organization and its patients, potentially leading to increased bad debt or patient dissatisfaction due to billing errors. Another incorrect approach that prioritizes metrics that are difficult to accurately measure or require extensive manual data collection without a clear return on investment is also professionally unsound. This diverts resources from more critical areas and can lead to unreliable data, hindering effective decision-making. Ethically, it represents a poor stewardship of organizational resources. The professional decision-making process for similar situations should involve a systematic evaluation of potential metrics against established revenue cycle goals, regulatory requirements, and resource availability. This includes understanding the underlying processes that each metric represents, the potential impact of improving that metric, and the feasibility of accurate and consistent measurement. Collaboration with clinical, financial, and compliance departments is crucial to ensure alignment and buy-in. The focus should always be on metrics that drive tangible improvements in financial performance and patient satisfaction, while upholding the highest ethical and regulatory standards. Question 3. Process analysis reveals that a patient requiring a high-cost, medically necessary procedure has expressed significant financial concerns and is unable to afford the upfront deposit. The revenue cycle team is under pressure to meet collection targets. What is the most appropriate course of action to ensure both financial health and ethical patient care? Option A. Initiate the procedure while simultaneously exploring all available financial assistance programs, charity care options, and flexible payment plans tailored to the patient's documented financial situation, ensuring no medically necessary service is denied due to inability to pay without exhausting all avenues. Option B. Advise the patient to seek alternative, less expensive treatment options, even if they are not the most clinically appropriate, to manage the immediate financial concern. Option C. Proceed with the procedure and aggressively pursue the full balance from the patient, including referring the account to external collection agencies immediately, regardless of their ability to pay. Option D. Inform the patient that the procedure cannot proceed until the full deposit is paid, as per standard policy, and defer any discussion of financial assistance until after the service has been rendered. Correct answer is A. Initiate the procedure while simultaneously exploring all available financial assistance programs, charity care options, and flexible payment plans tailored to the patient's documented financial situation, ensuring no medically necessary service is denied due to inability to pay without exhausting all avenues. Explanation. This scenario presents a common ethical dilemma in healthcare revenue cycle management, where financial pressures can conflict with patient well-being and regulatory compliance. The challenge lies in balancing the organization's need for revenue with its ethical obligation to provide care and adhere to patient protection laws. A professional must navigate these competing interests with integrity and a thorough understanding of relevant regulations. The correct approach prioritizes patient access to necessary care and upholds regulatory mandates designed to protect vulnerable individuals. This aligns with the core principles of healthcare ethics and the spirit of revenue cycle management, which, while focused on financial health, must operate within a framework of patient advocacy and legal compliance. Adhering to established protocols for financial assistance and patient advocacy ensures that financial barriers do not impede medically necessary treatment, thereby promoting equitable access to care and maintaining the organization's ethical standing. An incorrect approach that focuses solely on immediate revenue collection without considering patient financial circumstances or available assistance programs violates ethical principles of beneficence and justice. It can also lead to regulatory noncompliance, particularly concerning laws that protect patients from undue financial hardship or discriminatory billing practices. Such an approach risks patient harm, reputational damage, and potential legal repercussions. Another incorrect approach that involves pressuring patients to agree to payment plans they cannot afford, even if technically compliant with some billing procedures, is ethically unsound. It exploits a patient's vulnerability and can lead to significant financial distress, undermining the trust inherent in the patient-provider relationship. This approach fails to uphold the duty of care and can be seen as predatory. A third incorrect approach that involves delaying or denying medically necessary services based on an incomplete assessment of a patient's ability to pay, without exploring all available financial assistance options, is a direct contravention of ethical and potentially legal obligations. Healthcare providers have a responsibility to ensure patients receive appropriate care, and financial consideration should not be an insurmountable barrier when legitimate assistance pathways exist. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's clinical needs and financial situation. This involves actively exploring all available financial assistance programs, charity care options, and payment plan alternatives that are genuinely manageable for the patient. It requires open communication with the patient, adherence to organizational policies and regulatory requirements, and a commitment to patient advocacy. When faced with conflicting priorities, the ethical and regulatory imperative to ensure patient access to care and protection from undue financial burden should guide the decision-making process. Question 4. Risk assessment procedures indicate a need to reduce operational expenses within the revenue cycle. Which of the following approaches best aligns with professional best practices for cost analysis and budgeting in this context, ensuring long-term financial health and regulatory compliance? Option A. Conduct a comprehensive review of all revenue cycle processes to identify areas of inefficiency, potential for automation, and opportunities for resource optimization before implementing any significant budget reductions. Option B. Focus solely on negotiating lower rates with third-party vendors and suppliers without evaluating the internal operational costs or the impact on service quality. Option C. Immediately reduce staffing levels in departments with the highest perceived labor costs, reassigning remaining tasks to the existing workforce to achieve immediate savings. Option D. Freeze all spending on new technology and staff training programs for the next fiscal year to conserve immediate cash flow, deferring any upgrades or professional development. The correct answer is A. Conduct a comprehensive review of all revenue cycle processes to identify areas of inefficiency, potential for automation, and opportunities for resource optimization before implementing any significant budget reductions. Explanation. This scenario is professionally challenging because it requires a revenue cycle professional to balance the immediate need for cost containment with the long-term strategic implications of resource allocation within the revenue cycle. The pressure to reduce expenses can lead to short-sighted decisions that negatively impact efficiency, compliance, and ultimately, revenue capture. Careful judgment is required to identify cost-saving measures that do not compromise essential functions or violate regulatory requirements. The correct approach represents best professional practice because it prioritizes a data-driven, comprehensive analysis of the entire revenue cycle's cost structure before implementing any changes. This aligns with the Certified Revenue Cycle Professional (CRCP) exam's emphasis on understanding the interconnectedness of revenue cycle processes and the importance of informed decision-making. By focusing on identifying inefficiencies and optimizing existing resources, this approach minimizes the risk of unintended consequences, such as increased claim denials, delayed payments, or non-compliance with payer rules and federal regulations like the False Claims Act or HIPAA, which could lead to significant financial penalties and reputational damage. This proactive and analytical method ensures that cost reductions are sustainable and do not jeopardize the organization's financial health or legal standing. An incorrect approach that focuses solely on reducing staffing levels without a thorough analysis of workload distribution and process impact is professionally unacceptable. This could lead to burnout among remaining staff, increased errors, and a decline in claim submission and follow-up timeliness, directly impacting revenue. Ethically, it could be seen as a failure to adequately support the revenue cycle operations, potentially leading to patient dissatisfaction if billing issues arise. Another incorrect approach that involves cutting investments in technology upgrades or staff training, even if seemingly a quick cost-saving measure, is also professionally unsound. Such actions can lead to outdated systems that are less efficient and more prone to errors, and undertrained staff who are less effective in navigating complex payer requirements and regulatory changes. This can result in higher denial rates and increased administrative costs in the long run, violating the principle of prudent financial management and potentially leading to non-compliance with evolving payer mandates. The professional reasoning process for similar situations should involve a multi-step approach. 1. Understand the objective. Clearly define the goal of cost analysis and budgeting within the revenue cycle. 2. Gather comprehensive data. Collect data on all aspects of the revenue cycle, including staffing, technology, processes, and associated costs. 3. Analyze for inefficiencies. Identify areas where resources are being used suboptimally or where processes can be streamlined. 4. Evaluate impact of changes. Assess the potential downstream effects of any proposed cost-saving measures on revenue capture, denial rates, compliance, and patient satisfaction. 5. Prioritize strategic investments. Differentiate between essential operational costs and discretionary spending, and prioritize investments that yield long-term benefits. 6. Consult stakeholders. Engage with relevant departments and personnel to gain insights and ensure buy-in. 7. Develop a phased implementation plan. Introduce changes gradually to monitor their effectiveness and make adjustments as needed. 8. Monitor and adjust. Continuously track key performance indicators to ensure that cost-saving measures are achieving their intended outcomes without negative repercussions. Question 5. The risk matrix shows a high probability of patient non-payment for outstanding self-pay balances exceeding 90 days. The revenue cycle team is considering several strategies to address these accounts, which approach best balances regulatory compliance, ethical patient treatment, and effective revenue recovery. Option A. Write off all balances over 90 days as uncollectible to reduce administrative burden and focus on current claims. Option B. Conduct a thorough review of each account to identify potential eligibility for financial assistance or charity care, and engage in direct patient communication to discuss payment options before considering external collection. Option C. Immediately refer all accounts over 90 days to an external collection agency to maximize recovery speed. Option D. Implement a standardized payment plan for all patients with balances over 90 days, regardless of their stated ability to pay. The correct answer is C. Immediately refer all accounts over 90 days to an external collection agency to maximize recovery speed. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the organization's financial health with patient advocacy and adherence to complex billing regulations. The revenue cycle professional must navigate the delicate line between aggressive collection tactics and patient financial distress, all while ensuring compliance with the Patient Protection and Affordable Care Act, (ACA), and relevant state laws regarding fair debt collection practices. Missteps can lead to regulatory penalties, reputational damage, and erosion of patient trust. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient communication and exploring all available financial assistance options before escalating to more aggressive collection methods. This aligns with the ethical imperative to treat patients with dignity and respect, and it is supported by regulatory frameworks like the ACA, which encourages providers to offer financial assistance and payment plans to uninsured or underinsured patients. Proactive engagement with patients to understand their circumstances and offer tailored solutions is a cornerstone of responsible revenue cycle management and fosters a positive patient experience, ultimately contributing to a more sustainable collection process. Incorrect approaches analysis. One incorrect approach fails by immediately referring accounts to external collection agencies without attempting internal resolution or assessing the patient's ability to pay. This can violate fair debt collection practices by being overly aggressive and may not comply with organizational policies or payer agreements that require reasonable efforts to resolve self-pay balances internally. It also bypasses opportunities to identify potential eligibility for financial assistance programs, leading to unnecessary collection costs and potential patient hardship. Another incorrect approach is to write off accounts prematurely without exhausting all reasonable collection efforts or verifying the patient's financial situation. This represents a failure in due diligence and can negatively impact the organization's financial performance. It also may not align with payer contracts or regulatory requirements that mandate specific collection efforts before a balance can be deemed uncollectible. A third incorrect approach involves applying collection fees or interest charges that are not clearly disclosed to the patient upfront or are not permitted by state or federal law. This is a direct violation of fair debt collection practices and can lead to significant legal repercussions and damage to the organization's reputation. Transparency and adherence to legal limitations on fees are critical in patient billing. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough review of the patient's account, including insurance coverage, patient demographics, and the nature of the outstanding balance. This should be followed by a proactive outreach strategy to the patient, offering clear explanations of the bill and exploring their financial situation. If the patient expresses difficulty in paying, the next step is to assess their eligibility for financial assistance, payment plans, or charity care programs. Only after these internal resolution efforts have been exhausted and documented should the account be considered for referral to external collections, with strict adherence to all applicable regulations and organizational policies. Question 6. Process analysis reveals a significant increase in claim denials attributed to coding inaccuracies. The revenue cycle team is tasked with addressing this issue to improve reimbursement and ensure compliance. Which of the following approaches best aligns with professional best practices for auditing and compliance in coding? Option A. Rely exclusively on automated coding software to identify and correct all coding errors, minimizing human intervention in the review process. Option B. Immediately implement a strict policy of financial penalties for any coder found to have made an error, without further investigation into the cause of the errors. Option C. Implement a targeted education program for coders focusing on specific areas of identified coding deficiencies, coupled with a review of provider documentation practices to ensure clarity and completeness, and establish a regular audit schedule to monitor progress. Option D. Prioritize clearing the backlog of unbilled claims by expediting the coding process, even if it means reducing the depth of review for each claim. The correct answer is C. Implement a targeted education program for coders focusing on specific areas of identified coding deficiencies, coupled with a review of provider documentation practices to ensure clarity and completeness, and establish a regular audit schedule to monitor progress. Explanation. This scenario presents a common challenge in revenue cycle management, ensuring coding accuracy and compliance without negatively impacting provider productivity or patient care. The professional challenge lies in balancing the need for rigorous auditing with the operational realities of a busy healthcare facility. It requires a nuanced understanding of coding guidelines, payer requirements, and the impact of coding decisions on reimbursement and compliance. Careful judgment is essential to identify systemic issues versus isolated errors. The correct approach represents best professional practice because it focuses on a systematic, data-driven review of coding practices. By analyzing denial trends and identifying specific documentation or coding deficiencies, the revenue cycle team can implement targeted education and process improvements. This proactive strategy not only addresses immediate compliance risks, but also aims to prevent future errors, thereby optimizing revenue capture and minimizing claim rejections. This aligns with the certified revenue cycle professional's responsibility to uphold accurate financial and clinical data integrity, adhering to regulations like the False Claims Act and HIPAA security and privacy rules, which implicitly require accurate billing and coding. An incorrect approach that focuses solely on punitive measures for individual coders without investigating root causes is professionally unacceptable. This fails to address systemic issues and can lead to a demotivated coding team, potentially increasing errors due to fear rather than a lack of knowledge. It also ignores the possibility that documentation deficiencies by providers might be contributing to coding errors, shifting blame inappropriately. This approach risks violating ethical principles of fairness and due process, and could lead to noncompliance if widespread coding errors are not identified and corrected. Another incorrect approach that prioritizes speed over accuracy, aiming to clear backlogs without thorough review, is a direct violation of compliance standards. This increases the risk of submitting inaccurate claims, which can result in overpayments, underpayments, and significant penalties under regulations such as the Medicare Secondary Payer (MSP) rules and the Stark Law, which govern physician self-referral and billing practices. Such an approach undermines the integrity of the revenue cycle and exposes the organization to substantial financial and legal repercussions. A third incorrect approach that relies solely on automated coding software without human oversight is also professionally unsound. While technology is a valuable tool, it cannot fully replicate the clinical judgment and nuanced understanding required for complex coding scenarios. Over-reliance on automation without validation can lead to missed errors or incorrect coding, particularly in cases with ambiguous documentation or evolving payer policies. This can result in noncompliance with coding guidelines, e.g., IC 10cm, CPT, and payer-specific rules, leading to claim denials and potential audits. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Data analysis. Begin by analyzing denial data, claim rejection reports, and internal audit findings to identify patterns and trends. 2. Root cause analysis. Investigate the underlying reasons for identified coding errors, considering documentation completeness, coder education, payer policy interpretation, and system issues. 3. Targeted education and training. Develop and implement specific training programs for coders and providers based on the root cause analysis. 4. Process improvement. Modify workflows and implement checks and balances to prevent future errors. 5. Regular auditing. Conduct ongoing internal audits to monitor compliance and the effectiveness of implemented changes. 6. Collaboration. Foster open communication between coding, billing, compliance, and clinical departments to ensure a holistic approach to revenue cycle integrity. Question 7. The efficiency study reveals that patient registration processes are consistently causing significant delays in claim submission, leading to extended payment cycles. Which of the following approaches best addresses this revenue cycle challenge? Option A. Focus on expediting the data entry phase of patient registration to ensure claims are submitted as quickly as possible, even if the initial data collection was rushed. Option B. Conduct a comprehensive review of the entire patient registration workflow, from scheduling and pre-registration to on-site intake and data accuracy checks, to identify specific bottlenecks and implement targeted process improvements. Option C. Increase staffing levels in the claims submission department to handle the backlog created by registration delays. Option D. Implement aggressive follow-up procedures for all claims that are delayed, regardless of the reason for the delay. The correct answer is B. Conduct a comprehensive review of the entire patient registration workflow, from scheduling and pre-registration to on-site intake and data accuracy checks, to identify specific bottlenecks and implement targeted process improvements. Explanation. Scenario analysis. This scenario presents a common challenge in revenue cycle management where a perceived bottleneck in one area, patient registration, impacts downstream processes, claim submission, and payment posting. The professional challenge lies in identifying the root cause of the delay and implementing a solution that is both effective and compliant with revenue cycle best practices and relevant regulations. It requires a nuanced understanding of how process flow impacts financial outcomes and patient satisfaction, necessitating careful judgment to avoid superficial fixes. Correct approach analysis. The correct approach focuses on a comprehensive review of the entire patient registration process, from scheduling to final data entry. This aligns with best practices in revenue cycle management by addressing the potential root causes of delays rather than just the symptoms. By analyzing pre-registration, on-site registration, insurance verification, and data accuracy, it seeks to identify specific points of failure. This proactive and holistic approach ensures that improvements are sustainable and address systemic issues, ultimately leading to more efficient claim submission, reduced denials, and faster payment posting, all while maintaining compliance with payer requirements and patient privacy regulations, e.g., HIPAA in the U.S. This method prioritizes accuracy and completeness from the outset, which is crucial for a clean claim and timely reimbursement. Incorrect approach is analysis. One incorrect approach focuses solely on expediting the data entry phase without investigating why the data is not ready for entry sooner. This is a superficial fix that fails to address the underlying inefficiencies in the earlier stages of registration, such as scheduling or insurance verification. It risks introducing more errors due to rushed work, potentially leading to claim rejections and increased rework, which is a failure of operational efficiency and can violate payer requirements for accurate data submission. Another incorrect approach suggests increasing staffing in the claim submission department to compensate for registration delays. This is a reactive and inefficient solution. It does not solve the root problem of registration bottlenecks and incurs additional labor costs without improving the overall revenue cycle flow. This approach fails to adhere to principles of effective resource allocation and can be seen as a disregard for prudent financial management within the revenue cycle. A third incorrect approach involves implementing aggressive follow-up on claims that are delayed due to registration issues. While proactive follow-up is generally good practice, doing so for claims that are not yet clean or accurately submitted due to registration problems is premature and inefficient. It can lead to wasted effort by the follow-up team and may violate payer guidelines regarding the timing and nature of claim inquiries. This approach demonstrates a lack of understanding of the revenue cycle's sequential nature and can lead to non-compliance with payer policies. Professional reasoning. Professionals should approach this situation by first conducting a thorough process mapping and analysis of the patient registration workflow. This involves identifying all steps, stakeholders, and potential points of delay or error. Data analysis, including denial rates, claim submission timelines, and payment posting lags, should be used to quantify the impact of the registration delays. Based on this analysis, targeted interventions should be developed and implemented, focusing on process improvement, staff training, and technology utilization. Continuous monitoring and evaluation of the implemented solutions are essential to ensure sustained efficiency and compliance. This systematic approach ensures that decisions are data-driven, compliant, and focused on optimizing the entire revenue cycle. Question 8. The monitoring system demonstrates a consistent pattern of claims being submitted to payers beyond the stipulated timely filing limits, resulting in a significant increase in denied claims and a negative impact on the organization's accounts receivable days. Which of the following stakeholder engagement strategies is most appropriate for addressing this revenue cycle challenge? Option A. Convene a cross-functional task force comprising representatives from patient access, health information management, coding, billing, and payer relations to analyze the end-to-end claim submission process, identify specific bottlenecks, and collaboratively develop and implement process improvements. Option B. Conduct an immediate audit of all historical denied claims to identify patterns of payer non-payment without engaging upstream revenue cycle departments in the investigation. Option C. Escalate all delayed claims directly to payer dispute resolution departments for immediate review and payment, bypassing internal root cause analysis. Option D. Implement a mandatory overtime policy for the billing department to expedite claim processing and submission, with individual performance metrics tied directly to submission timeliness. The correct answer is A. Convene a cross-functional task force comprising representatives from patient access, health information management, coding, billing, and payer relations to analyze the end-to-end claim submission process, identify specific bottlenecks, and collaboratively develop and implement process improvements. Explanation: the monitoring system demonstrates a recurring pattern of delayed claim submissions to payers, impacting cash flow and potentially incurring penalties. This scenario is professionally challenging because it requires identifying the root cause of the delay, which likely involves multiple departments and stakeholders within the revenue cycle. Effective judgment is needed to balance the urgency of financial recovery with the need for sustainable process improvements and adherence to payer contracts and regulations. The correct approach involves a collaborative review with key revenue cycle stakeholders, including patient access, HIM, billing, and payer relations departments, to identify bottlenecks and implement corrective actions. This represents best professional practice because it aligns with the principles of integrated revenue cycle management, emphasizing communication and shared responsibility. Specifically, it adheres to the ethical obligation to manage financial resources responsibly and efficiently, as outlined in professional standards for revenue cycle professionals, and implicitly supports compliance with payer agreements that stipulate timely filing limits. This proactive, cross-functional approach ensures that solutions are comprehensive and address systemic issues rather than superficial symptoms, thereby improving overall revenue cycle performance and patient satisfaction. An incorrect approach would be to solely focus on the billing department's performance metrics without investigating upstream processes. This fails to acknowledge the interconnectedness of the revenue cycle and may lead to punitive measures against one department, ignoring the true source of the problem. This approach is ethically questionable as it can foster a blame culture and is inefficient, failing to achieve sustainable improvement. It also risks noncompliance with payer requirements if the underlying issues, such as incomplete patient registration or coding delays, are not addressed. Another incorrect approach is to implement a blanket policy of aggressive follow-up on all delayed claims without understanding the reasons for the delay. While seemingly proactive, this can lead to increased administrative burden, burnout among staff, and potentially inappropriate escalation of issues to payers, damaging provider-payer relationships. This approach is professionally unsound as it prioritizes activity over effective problem-solving and may violate ethical guidelines regarding responsible resource utilization and professional conduct in interactions with payers. Finally, an incorrect approach would be to ignore the trend, assuming it is a temporary fluctuation. This demonstrates a lack of due diligence and a failure to uphold the professional responsibility to maintain the financial health of the organization. This inaction can lead to significant financial losses, increased bad debt, and potential regulatory scrutiny for noncompliance with timely filing requirements, which are often stipulated in payer contracts and can have legal ramifications. Professionals should employ a systematic decision-making process that begins with data analysis to identify trends and anomalies. This should be followed by cross-functional team engagement to diagnose root causes, develop collaborative solutions, implement corrective actions, and establish ongoing monitoring to ensure sustained improvement. This iterative process, grounded in ethical principles and regulatory awareness, is crucial for effective revenue cycle management. Question 9. Assessment of how a healthcare organization's revenue cycle management practices, specifically its approach to denial management and accounts receivable follow-up, directly impacts its reported net patient service revenue and overall financial health, considering the regulatory framework for revenue recognition and financial reporting. Option A. Neglecting timely and accurate denial follow-up, allowing claims to age beyond payer timely filing limits without proper resolution. Option B. Prioritizing the maximization of gross charges billed without considering payer contract terms and expected reimbursement rates, leading to inflated accounts receivable. Option C. Aggressively writing off aged accounts receivable without a thorough investigation into the reasons for non-payment to artificially reduce days in accounts receivable. Option D. Implementing a robust denial management program that focuses on root cause analysis and process improvement to reduce claim rejections and accelerate payment, thereby ensuring accurate revenue recognition and minimizing bad debt expense. The correct answer is D. Implementing a robust denial management program that focuses on root cause analysis and process improvement to reduce claim rejections and accelerate payment, thereby ensuring accurate revenue recognition and minimizing bad debt expense. Explanation: the scenario presents a common challenge in revenue cycle management, balancing the need for efficient claim submission with the imperative of accurate financial reporting, particularly concerning the impact on overall financial performance. Professionals must navigate the complexities of payer rules, coding accuracy, and timely follow-up to ensure revenue is recognized appropriately, and that financial statements reflect a true and fair view of the organization's financial health. This requires a deep understanding of how revenue cycle processes directly influence key financial metrics such as net patient service revenue, accounts receivable days, and bad debt expense. The correct approach emphasizes a proactive and integrated strategy that aligns revenue cycle operations with financial reporting standards. By focusing on root cause analysis of denials and implementing process improvements that reduce claim rejections and accelerate payment, the organization can significantly improve its financial performance. This aligns with the certified revenue cycle professional's ethical obligation to uphold financial integrity and ensure compliance with relevant regulations, such as those governing healthcare billing and financial disclosures. A robust revenue cycle directly contributes to accurate revenue recognition, minimizes uncollectible accounts, and enhances cash flow, all critical components of sound financial management. An incorrect approach that prioritizes aggressive write-offs to artificially reduce accounts receivable days without a thorough investigation of the underlying reasons for non-payment is ethically and regulatorily unsound. This practice can mask underlying operational inefficiencies and lead to inaccurate financial reporting, potentially violating principles of GAAP, generally accepted accounting principles, and specific healthcare financial regulations. It also fails to address the root causes of claim denials, leading to recurring issues and a sustained negative impact on financial performance. Another incorrect approach that focuses solely on maximizing gross charges without adequate attention to payer contract terms and expected reimbursement rates can lead to inflated accounts receivable and an inaccurate picture of net revenue. This can result in significant write-offs later, impacting bad debt expense and overall profitability. It demonstrates a lack of understanding of how contractual adjustments and payer limitations directly affect realized revenue. A third incorrect approach that neglects the importance of timely and accurate denial management, allowing claims to age without proper follow-up, directly harms financial performance. This leads to increased uncollectible accounts, higher administrative costs for reprocessing, and a reduction in overall cash collections. It also signifies a failure to adhere to best practices in revenue cycle management, which are implicitly tied to maintaining financial health and compliance. The professional decision-making process for similar situations should involve a comprehensive review of revenue cycle metrics, identifying areas of underperformance. This should be followed by a root cause analysis of identified issues, such as denial trends or extended A/R days, implementing data-driven process improvements, ensuring staff training on coding and payer guidelines, and establishing clear communication channels between billing, coding, and financial reporting departments are crucial steps. Regular audits and performance monitoring are essential to ensure ongoing compliance and optimal financial outcomes. Question 10. Comparative studies suggest that variations in clinical documentation significantly impact coding accuracy. A physician documents a patient encounter for management of chronic obstructive pulmonary disease, COPD, with exacerbation. The physician's notes describe increased shortness of breath and wheezing, but do not specify the severity of the exacerbation or any particular underlying cause beyond the chronic condition. The physician also performed a standard office visit for medication review and adjustment. Which of the following coding approaches best reflects professional practice and regulatory compliance for this encounter? Option A. Assign an ICD-10-CM code for unspecified COPD with exacerbation and a CPT code for a standard office visit, as the documentation is sufficient for general management. Option B. Assign the ICD-10-CM code for COPD without exacerbation, assuming the exacerbation is a common occurrence and not a distinct clinical event requiring specific coding, and assign a CPT code for medication management. Option C. Query the physician for clarification on the severity of the COPD exacerbation and any specific contributing factors, before assigning the ICD-10-CM code, and assign the appropriate CPT code for the office visit based on medical necessity and time spent. Option D. Assign a more specific ICD-10-CM code for COPD with acute exacerbation, even though the documentation does not explicitly state acute, to reflect the patient's current symptoms. The correct answer is A. Assign an ICD-10-CM code for unspecified COPD with exacerbation and a CPT code for a standard office visit, as the documentation is sufficient for general management. Explanation. This scenario presents a common challenge in revenue cycle management, accurately capturing the complexity of patient encounters through appropriate coding. The professional challenge lies in balancing the need for specificity in ICD-10-CM and CPT coding, with the potential for misinterpretation or oversimplification that can lead to claim denials, audits, or even compliance issues. The physician's documentation, while providing a general overview, lacks the granular detail required for precise coding. This necessitates a coder's expertise to query for clarification or apply coding guidelines judiciously. The correct approach represents best professional practice because it prioritizes accurate and compliant coding by seeking clarification from the physician. This aligns with the fundamental principles of ICD-10-CM and CPT coding, which emphasize coding to the highest level of specificity documented. Querying the physician ensures that the codes assigned reflect the actual services rendered and the patient's condition, thereby supporting accurate reimbursement and avoiding potential fraud or abuse allegations. This proactive step demonstrates a commitment to ethical coding and adherence to payer guidelines. An incorrect approach that involves assigning a less specific ICD-10-CM code without physician clarification fails to meet the requirement for specificity. This can lead to underpayment or overpayment, and if done systematically, could be flagged during audits. Assigning a CPT code that is not fully supported by the documentation, even if it appears to align with the general description, is a direct violation of coding guidelines and can result in claim denials and potential penalties for fraudulent billing. Another incorrect approach, such as defaulting to a unspecified diagnosis code when more specific information is available or could be obtained, undermines the integrity of the medical record and the billing process. This practice is not compliant with ICD-10-CM official guidelines for coding and reporting. The professional decision-making process for similar situations should involve a thorough review of the medical documentation, a clear understanding of ICD-10-CM and CPT coding principles, and a commitment to querying the provider when documentation is ambiguous or incomplete. Professionals should always err on the side of seeking clarification to ensure accuracy and compliance, rather than making assumptions that could compromise the integrity of the revenue cycle. Question 11. The audit findings indicate that a healthcare provider has been recognizing revenue for services rendered based on the date the patient's insurance claim is submitted, rather than the date the service was actually provided and patient responsibility was determined. This practice has led to potential overstatement of revenue in periods prior to service delivery. Which of the following approaches best aligns with U.S. GAAP revenue recognition principles for this scenario? Option A. Recognize revenue based on the contractual agreement's billing cycle, irrespective of service delivery or patient responsibility determination. Option B. Recognize revenue when the healthcare provider has fulfilled its performance obligation by providing the service to the patient and control has transferred, evidenced by documentation of service delivery and patient acceptance. Option C. Recognize revenue only when the insurance company has fully processed and paid the claim, ensuring the cash has been received. Option D. Recognize revenue upon the submission of the insurance claim, as this signifies the initiation of the revenue collection process. The correct answer is B. Recognize revenue when the healthcare provider has fulfilled its performance obligation by providing the service to the patient and control has transferred, evidenced by documentation of service delivery and patient acceptance. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of revenue recognition principles within the specific regulatory framework of the Certified Revenue Cycle Professional (CRCP) exam, which is understood to be U.S.-based, primarily referencing ASC 606. The core challenge lies in determining when control of a promised good or service is transferred to the customer, which is the trigger for revenue recognition under ASC 606. This involves judgment, especially when contracts have multiple performance obligations or variable consideration. The correct approach represents best professional practice because it directly aligns with the five-step model of ASC 606, emphasizing the transfer of control. By focusing on the objective evidence of transfer of control, the professional ensures compliance with the core principle of revenue recognition. This approach prioritizes accurate financial reporting and avoids premature or deferred revenue recognition, which could mislead stakeholders. It demonstrates a commitment to adhering to the established accounting standards, fostering trust and transparency in financial statements. An incorrect approach that recognizes revenue solely based on the issuance of an invoice fails to adhere to ASC 606. The issuance of an invoice is a billing event, not necessarily an indicator of control transfer. This approach risks recognizing revenue before the entity has fulfilled its performance obligation and before the customer has obtained control, leading to misstated financial results. This is a direct violation of the revenue recognition principle. Another incorrect approach that defers revenue recognition until all contractual obligations are met, regardless of whether individual performance obligations have been satisfied and control has transferred for specific goods or services, also violates ASC 606. This can lead to understating revenue in the current period and overstating it in future periods, distorting financial performance trends, and potentially misrepresenting the entity's economic performance. A third incorrect approach that recognizes revenue based on the customer's subjective intent to pay without objective evidence of control transfer is also professionally unacceptable. Revenue recognition requires objective evidence, not mere assumptions about customer intent. This approach introduces significant subjectivity and risk of misstatement, undermining the reliability of financial reporting. The professional reasoning process for similar situations should involve a systematic application of the ASC 606 five-step model. 1. Identify the contract S with a customer. 2. Identify the performance obligations in the contract. 3. Determine the transaction price. 4. Allocate the transaction price to the performance obligations. 5. Recognize revenue when, or as, the entity satisfies a performance obligation by transferring a promised good or service to a customer. This structured approach ensures all relevant criteria are considered and promotes consistent and compliant revenue recognition. Question 12. To address the challenge of ensuring revenue cycle operations remain compliant with federal healthcare regulations, a revenue cycle manager is evaluating different strategies for claim submission and patient account management. Which approach best mitigates regulatory risk while maintaining operational efficiency? Option A. Relying on historical billing practices and assuming current processes are compliant unless specific regulatory enforcement actions are directly communicated to the organization. Option B. Streamlining patient registration and insurance verification processes to expedite patient throughput, accepting minimal documentation upfront to avoid delaying the billing cycle, and addressing any resulting claim denials or billing discrepancies later. Option C. Implementing a comprehensive, ongoing risk assessment program that identifies potential compliance vulnerabilities in all revenue cycle processes, followed by the development and implementation of targeted internal controls and regular audits to address identified risks. Option D. Prioritizing the highest possible claim submission volume each billing cycle, with a secondary focus on addressing any identified compliance issues only after claims have been submitted and paid. The correct answer is C. Implementing a comprehensive, ongoing risk assessment program that identifies potential compliance vulnerabilities in all revenue cycle processes, followed by the development and implementation of targeted internal controls and regular audits to address identified risks. Explanation. The scenario presents a common challenge in revenue cycle management, balancing the need for accurate and timely claim submission with the imperative to comply with evolving healthcare regulations. The professional challenge lies in interpreting and applying complex regulatory frameworks, such as the False Claims Act and HIPAA, to day-to-day revenue cycle operations, without introducing errors that could lead to financial penalties or reputational damage. Careful judgment is required to assess the risk of non-compliance versus the operational efficiency gained by certain practices. The correct approach represents best professional practice because it prioritizes a proactive and systematic risk assessment process. This involves identifying potential areas of regulatory vulnerability within the revenue cycle, such as coding accuracy, documentation completeness, and timely filing. By implementing robust internal controls and regular audits, organizations can mitigate these risks before they manifest as compliance violations. This aligns with the principles of due diligence and good corporate citizenship, as mandated by various healthcare regulations that emphasize preventing fraud, waste, and abuse. Adhering to these proactive measures demonstrates a commitment to ethical operations and regulatory adherence, which is crucial for maintaining patient trust and financial stability. An incorrect approach that focuses solely on maximizing claim submission volume without adequate regulatory review poses significant risks. This could lead to the submission of inaccurate or fraudulent claims, violating the False Claims Act and potentially resulting in severe penalties, including treble damages and exclusion from federal healthcare programs. Another incorrect approach that prioritizes speed over thoroughness in patient registration and insurance verification could result in billing errors and denials, impacting revenue, but also potentially leading to improper billing practices if not corrected, which could be construed as a violation of billing regulations. Furthermore, neglecting to update revenue cycle processes in response to new regulatory guidance, such as changes in Medicare billing requirements or HIPAA enforcement priorities, demonstrates a failure to maintain compliance and exposes the organization to penalties for non-adherence. Professionals should employ a decision-making framework that begins with a comprehensive understanding of applicable regulations. This involves continuous education and staying abreast of regulatory changes. The next step is to conduct a thorough risk assessment of all revenue cycle functions, identifying potential compliance gaps. Based on this assessment, a risk mitigation strategy should be developed and implemented, including the establishment of clear policies and procedures, staff training, and regular monitoring and auditing. Finally, a culture of compliance should be fostered throughout the organization, encouraging open communication about potential issues and a commitment to ethical practices. Question 13. The efficiency study reveals that the patient registration and scheduling process at a large multi-specialty clinic is experiencing significant delays, leading to increased patient wait times and dissatisfaction. Which of the following strategies would best address these issues while adhering to professional revenue cycle management principles? Option A. Immediately deploy a comprehensive, feature-rich patient portal for all registration and scheduling functions without prior staff training or system integration testing. Option B. Significantly increase the number of registration staff without analyzing or modifying existing workflows or technology. Option C. Implement a phased technology integration strategy, beginning with optimizing the existing electronic health record, (EHR), system for pre-registration and appointment reminders, followed by a pilot program for a patient self-scheduling portal for routine appointments. Option D. Prioritize rapid patient check-in by minimizing the collection of demographic and insurance information during the initial registration process. The correct answer is C. Implement a phased technology integration strategy, beginning with optimizing the existing electronic health record, (EHR), system for pre-registration and appointment reminders, followed by a pilot program for a patient self-scheduling portal for routine appointments. Explanation. The efficiency study reveals that the patient registration and scheduling process at a large multi-specialty clinic is experiencing significant delays, leading to increased patient wait times and dissatisfaction. This scenario is professionally challenging because it directly impacts patient access to care, operational efficiency, and the financial health of the organization. Balancing the need for thorough data collection during registration with the imperative to expedite the scheduling process requires careful judgment. The correct approach is to implement a phased technology integration strategy, starting with optimizing the existing electronic health record, (EHR), system for pre-registration and appointment reminders, followed by a pilot program for a patient self-scheduling portal for routine appointments. This represents best professional practice because it aligns with the principles of patient-centered care and operational excellence, as emphasized by industry best practices and likely reflected in Certified Revenue Cycle Professional (CRCP) guidelines. Phased implementation minimizes disruption, allows for staff training and adaptation, and provides opportunities to refine processes based on real-world feedback. It also leverages technology to empower patients while ensuring data integrity and compliance with privacy regulations, e.g., HIPAA in the U.S. context. If applicable to the exam's jurisdiction, an incorrect approach would be to immediately implement a complex, all-encompassing patient portal without adequate staff training or system integration testing. This is professionally unacceptable as it risks overwhelming staff, introducing data errors, and potentially violating patient privacy if security protocols are not robust. It fails to consider the human element of change management and the importance of a gradual, controlled rollout. Another incorrect approach is to solely focus on increasing staffing levels in the registration department without addressing underlying process inefficiencies. While more staff might temporarily reduce wait times, it does not solve the root cause of the delays and is financially unsustainable. This approach neglects the opportunity to leverage technology and streamline workflows, which are critical for long-term revenue cycle optimization. A third incorrect approach is to prioritize speed over accuracy in patient data collection during registration. This is professionally unacceptable as incomplete or inaccurate demographic and insurance information can lead to claim denials, delayed payments, and increased rework, directly impacting the revenue cycle. It also poses ethical concerns regarding patient safety if critical medical information is not accurately captured. The professional reasoning process for similar situations should involve a thorough root cause analysis of the identified inefficiencies. This includes evaluating current workflows, technology utilization, staff training, and patient feedback. Once the root causes are understood, potential solutions should be brainstormed, considering their impact on patient experience, operational efficiency, financial outcomes, and regulatory compliance. A risk assessment should be conducted for each potential solution, and a phased implementation plan with clear metrics for success should be developed. Continuous monitoring and adaptation are crucial for sustained improvement. Question 14. The control framework reveals a consistent pattern of incomplete physician documentation for certain complex procedures performed in the outpatient setting. This incomplete documentation often lacks specific details required by payers to justify the level of service billed, leading to potential underpayments or denials. A revenue cycle team member identifies this recurring issue and is concerned about its impact on revenue integrity and compliance. What is the most appropriate course of action for the revenue cycle team member to take? Option A. Immediately escalate the issue to the compliance department and request a review of the documentation and coding practices for these procedures, while temporarily holding claims for services with incomplete documentation until clarification is obtained. Option B. Implement a policy to automatically downcode all complex procedures when documentation is incomplete to avoid potential audits, even if it means significant revenue loss. Option C. Proceed with billing for the services based on the available documentation, assuming the physician's intent was to bill for the most common services performed, to avoid delaying revenue collection. Option D. Advise the physicians to simply resubmit the same incomplete documentation with a note indicating the services were performed to expedite the billing process. The correct answer is A. Immediately escalate the issue to the compliance department and request a review of the documentation and coding practices for these procedures, while temporarily holding claims for services with incomplete documentation until clarification is obtained. Explanation. This scenario presents a common challenge in revenue cycle management, ensuring accurate charge capture and coding to comply with payer requirements and prevent financial loss or fraud. The professional challenge lies in balancing the need for timely billing with the imperative of coding accuracy, especially when faced with incomplete documentation. Careful judgment is required to avoid both undercoding, leading to lost revenue, and overcoding, leading to potential fraud and abuse investigations. The correct approach represents best professional practice because it prioritizes obtaining complete and accurate documentation before submitting claims. This aligns with the fundamental principles of compliant billing, which mandate that all services billed must be supported by clear and sufficient medical records. By seeking clarification and additional documentation, the revenue cycle professional upholds the integrity of the billing process and minimizes the risk of payer denials or audits. This proactive stance ensures adherence to regulations like the False Claims Act and payer-specific guidelines that require accurate representation of services rendered. An incorrect approach that involves proceeding with billing based on assumptions or incomplete documentation fails to meet the standard of care. This can lead to regulatory violations, such as submitting false claims, which carry significant penalties. Ethically, it is a breach of trust with both the patient and the payer. Another incorrect approach, such as delaying billing indefinitely without a clear plan to obtain missing information, can lead to missed filing deadlines, resulting in lost revenue and impacting the organization's financial health, which is also a failure in professional responsibility. Professionals should employ a decision-making framework that begins with identifying potential documentation gaps. They should then proactively communicate with the responsible clinicians or departments to request the necessary information. If clarification is still needed after initial requests, escalation to a supervisor or a dedicated compliance officer should be considered. The ultimate goal is to ensure that every charge submitted is accurate, supported by documentation, and compliant with all applicable regulations and payer policies. Question 15. The assessment process reveals that a large hospital system is experiencing a significant increase in claim denials from major payers due to coding inaccuracies and incomplete documentation. The revenue cycle team is under pressure to meet month-end closing deadlines for financial reporting. One proposed approach is to immediately write off all denied claims older than 90 days to reduce the accounts receivable aging and expedite the closing process. Another suggestion is to defer revenue recognition for all claims currently in the denial management process until they are either paid or definitively deemed uncollectible. A third option is to conduct a thorough root cause analysis of the denials, review payer contracts for compliance, and apply appropriate accounting estimates for contractual allowances and uncollectible accounts before finalizing the financial statements. Option A. Immediately write off all denied claims older than 90 days to reduce the accounts receivable aging and expedite the closing process. Option B. Defer revenue recognition for all claims currently in the denial management process until they are either paid or definitively deemed uncollectible. Option C. Conduct a thorough root cause analysis of the denials, review payer contracts for compliance, and apply appropriate accounting estimates for contractual allowances and uncollectible accounts before finalizing the financial statements. Option D. Focus solely on collecting outstanding balances, disregarding the denial trends for the current reporting period. The correct answer is C. Conduct a thorough root cause analysis of the denials, review payer contracts for compliance, and apply appropriate accounting estimates for contractual allowances and uncollectible accounts before finalizing the financial statements. Explanation. The assessment process reveals a common challenge in revenue cycle management: the tension between timely financial reporting and the accurate reflection of revenue, especially when dealing with complex contractual arrangements and potential denials. This scenario is professionally challenging because it requires a deep understanding of both accounting principles and the operational realities of healthcare billing and collections, necessitating careful judgment to ensure compliance and financial integrity. The correct approach represents best professional practice because it prioritizes the accurate and compliant recognition of revenue according to generally accepted accounting principles, GAAP, and relevant healthcare regulations. This involves a thorough review of payer contracts, denial management processes, and the application of appropriate accounting estimates for uncollectible accounts and contractual allowances. By proactively addressing potential revenue leakage and ensuring that financial statements reflect the most probable collectible amount, this approach upholds the ethical obligation to present a true and fair view of the organization's financial position. It aligns with the principles of transparency and accountability expected of revenue cycle professionals. An incorrect approach that involves prematurely writing off uncollectible accounts without a comprehensive review of denial trends or contractual obligations is professionally unacceptable. This failure to investigate the root causes of denials or to accurately apply contractual terms can lead to misstated revenue and an inaccurate picture of financial performance. May also violate regulatory requirements that mandate proper documentation and justification for write-offs. Furthermore, it can mask operational inefficiencies within the revenue cycle, hindering opportunities for process improvement. Another incorrect approach, which is to delay the recognition of revenue until all potential denials are resolved, is also professionally unsound. This can lead to significant delays in financial reporting, misrepresenting the organization's current financial health and potentially impacting operational decision-making. It also fails to adhere to the accrual basis of accounting, which requires revenue to be recognized when earned, regardless of immediate cash collection. This approach can also lead to an overstatement of accounts receivable and an inaccurate assessment of the allowance for doubtful accounts. The professional reasoning process for similar situations should involve a systematic evaluation of all available data, including payer contracts, denial reports, patient account aging, and relevant accounting standards. Professionals must engage in critical thinking to identify potential discrepancies and apply sound judgment in estimating allowances and contractual adjustments. This includes understanding the nuances of payer agreements, the impact of regulatory changes on revenue recognition, and the importance of robust internal controls to ensure the accuracy and completeness of financial data. Collaboration with clinical, billing, and compliance departments is crucial to gain a holistic understanding of the revenue cycle and to implement effective solutions. Question 16. Consider a scenario where a healthcare provider experiences a sudden and significant increase in claim denials from a major payer, directly attributed to a recently implemented, complex policy change by that payer. The revenue cycle team is under pressure to quickly reverse this trend and recover lost revenue. What is the most effective and compliant approach for the provider to manage this situation? Option A. Continue submitting claims according to the previous established procedures, believing the payer will eventually correct their denial patterns. Option B. Conduct a thorough analysis of the denial data to identify specific patterns and root causes, engage in direct communication with the payer for clarification, and implement targeted staff education and process adjustments based on the findings. Option C. Immediately initiate appeals for all denied claims, assuming the payer's new policy is being misapplied. Option D. Focus solely on increasing the volume of claims processed by the billing department to offset the financial impact of the denials. Correct answer is C. Immediately initiate appeals for all denied claims, assuming the payer's new policy is being misapplied. Explanation. Scenario analysis. This scenario presents a common challenge in revenue cycle management, where a provider faces a significant increase in claim denials due to a new payer policy. The professional challenge lies in balancing the immediate financial impact of denials with the long-term implications of payer relationships and compliance. A hasty or reactive approach could lead to further financial losses, compliance violations, or damage to the provider's reputation. Careful judgment is required to identify the root cause of the denials and implement a sustainable solution. Correct approach analysis. The correct approach involves a systematic, data-driven investigation to understand the specific reasons for the increased denials. This includes analyzing denial codes, identifying common patterns, and directly communicating with the payer to clarify the new policy's interpretation and application. By collaborating with the payer and educating internal staff on the updated requirements, the provider can address the root cause of the denials, improve claim submission accuracy, and ultimately reduce denial rates. This aligns with the Certified Revenue Cycle Professional (CRCP) exam's emphasis on proactive problem-solving, adherence to payer guidelines, and maintaining compliant revenue cycle operations. It demonstrates a commitment to accurate billing and efficient revenue capture, which are fundamental to revenue cycle management. Incorrect approaches analysis. One incorrect approach is to immediately appeal all denials without first understanding the specific reasons. This is inefficient, costly, and unlikely to be successful if the claims are indeed non-compliant with the new policy. It represents a failure to conduct due diligence and a reactive rather than proactive strategy, potentially violating payer agreement terms regarding accurate claim submission. Another incorrect approach is to ignore the payer's new policy and continue submitting claims as before, hoping the denials will be overturned. This demonstrates a disregard for payer requirements and a lack of understanding of contractual obligations. It poses a significant compliance risk, as it can lead to accusations of intentional misrepresentation or failure to adhere to established billing practices, potentially resulting in audits, recoupments, and penalties. A third incorrect approach is to focus solely on increasing staff productivity to process more claims, without addressing the underlying denial issue. This fails to recognize that increased denial rates indicate a systemic problem, not just a volume issue. It can lead to burnout, increased errors, and a worsening denial trend, ultimately harming the revenue cycle and potentially violating ethical standards related to competent revenue cycle management. Professional reasoning. Professionals should approach such situations by first gathering data to understand the scope and nature of the problem. This involves detailed denial analysis. Next, they should engage in clear and direct communication with the payer to seek clarification and understand their perspective. Based on this understanding, a targeted education and process improvement plan should be developed and implemented. Continuous monitoring and evaluation of denial trends are crucial to ensure the effectiveness of implemented solutions and to adapt to future changes. This systematic approach ensures compliance, optimizes revenue capture, and fosters positive payer relationships. Question 17. The investigation demonstrates a consistent pattern of claim denials due to incomplete patient demographic and insurance information at the point of submission. This has led to significant delays in reimbursement and increased administrative costs associated with claim rework. Which of the following strategies is the most effective in addressing this recurring issue and improving the overall claim submission process? Option A. Implement a mandatory pre-submission checklist that verifies the presence of all required demographic and insurance data fields against payer-specific guidelines before a claim is electronically submitted. Option B. Focus on negotiating faster payment terms with payers for claims that have been previously denied and resubmitted. Option C. Increase the frequency of staff training sessions on data entry, best practices for patient registration and insurance verification. Option D. Expedite the resubmission process for all denied claims, prioritizing those with the highest dollar values to recover revenue as quickly as possible. The correct answer is A. Implement a mandatory pre-submission checklist that verifies the presence of all required demographic and insurance data fields against payer-specific guidelines before a claim is electronically submitted. Explanation. The investigation demonstrates a common challenge in revenue cycle management, ensuring accurate and timely claim submission to maximize reimbursement while adhering to payer regulations. The scenario is professionally challenging because it requires a delicate balance between speed and accuracy, where errors can lead to claim denials, delayed payments, and potential compliance issues. Careful judgment is required to identify the root cause of the submission errors and implement sustainable solutions. The correct approach represents best professional practice because it directly addresses the identified systemic issue of incomplete documentation impacting claim submission. By implementing a pre-submission review process that specifically verifies the completeness of required documentation against payer guidelines, the organization proactively prevents errors before they reach the payer. This aligns with the principles of accurate billing and coding, minimizing the likelihood of denials due to missing information. Such a proactive measure reduces rework, improves cash flow, and demonstrates a commitment to compliance with payer requirements, which is a cornerstone of effective revenue cycle management. An incorrect approach that relies solely on resubmitting denied claims without addressing the underlying cause fails to prevent future errors. This reactive strategy leads to a continuous cycle of denials and resubmissions, increasing administrative burden and delaying revenue. It also risks non-compliance with payer policies regarding timely filing limits and repeated submission of incomplete data. Another incorrect approach that focuses only on staff training without a structured process for verifying documentation is insufficient. While training is important, it does not guarantee that all necessary steps are consistently followed in a high-volume environment. Without a system to check for completeness, even well-trained staff can overlook critical details, leading to the same submission errors. This approach lacks the necessary controls to ensure accuracy. A third incorrect approach that involves prioritizing claims based on perceived urgency without a systematic check for completeness is also flawed. While urgency is a factor in revenue cycle, submitting incomplete claims, even if prioritized, will likely result in denials, negating any perceived speed advantage. This approach prioritizes speed over accuracy and compliance, which is detrimental to the revenue cycle. Professionals should employ a decision-making framework that begins with root cause analysis of claim submission issues. This involves examining denial trends, identifying common denial reasons, and tracing the workflow that led to the error. Once the root cause is identified, the focus should shift to implementing preventative controls and process improvements. This includes establishing clear documentation requirements, implementing pre-submission checks, and leveraging technology where appropriate. Continuous monitoring and performance evaluation are crucial to ensure the effectiveness of implemented solutions and to adapt to evolving payer requirements. Question 18. Upon reviewing the draft of the hospital's annual financial statements, the certified revenue cycle professional notices that the operating margin appears significantly lower than anticipated due to an unexpected increase in uncompensated care write-offs. While the write-offs are legitimate and documented, the professional is concerned that this figure might negatively impact the hospital's bond rating and donor confidence. Professional considers several ways to present this information. Option A. Omit the detailed breakdown of uncompensated care write-offs from the footnotes, focusing only on the net revenue figure to avoid drawing undue attention to the negative trend. Option B. Reclassify a portion of the uncompensated care write-offs as a contra-revenue account to reduce their direct impact on the operating margin, thereby presenting a more favorable financial picture. Option C. Delay the release of the financial statements until the next quarter, hoping that improved collections will offset the current quarter's uncompensated care impact and present a stronger overall financial performance. Option D. Present the financial statements as prepared, ensuring all write-offs are accurately reflected and providing a clear footnote explaining the increase in uncompensated care and its impact on the operating margin. The correct answer is D. Present the financial statements as prepared, ensuring all write-offs are accurately reflected and providing a clear footnote explaining the increase in uncompensated care and its impact on the operating margin. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for accurate financial reporting with the potential for misinterpretation or misuse of financial data by stakeholders. The revenue cycle professional must exercise sound judgment to ensure transparency and ethical conduct. The correct approach represents best professional practice because it prioritizes adherence to generally accepted accounting principles (GAAP) and relevant healthcare industry guidelines. By presenting the financial statements as they are, with appropriate disclosures, and without manipulation, the professional upholds the integrity of financial reporting. This aligns with the ethical obligation to provide truthful and unbiased information, as mandated by professional codes of conduct for revenue cycle professionals and the overarching regulatory framework governing healthcare finance. Transparency in financial reporting is crucial for maintaining trust with all stakeholders, including patients, payers, and regulatory bodies. An incorrect approach that involves adjusting the financial statements to present a more favorable, albeit misleading, picture would constitute a violation of ethical principles and potentially regulatory requirements. Such manipulation undermines the reliability of financial information, which is essential for informed decision-making by investors, creditors, and management. Could also lead to misrepresentation of the organization's financial health, potentially impacting reimbursement rates, creditworthiness, and compliance with payer contracts. Another incorrect approach, such as withholding the financial statements until a more opportune time or until they can be improved, also represents a failure. This delays transparency and can be interpreted as an attempt to conceal unfavorable performance, which is ethically questionable and may violate reporting deadlines or contractual obligations. It prevents stakeholders from accessing critical information in a timely manner, hindering their ability to assess the organization's financial standing. The professional decision-making process for similar situations should involve a thorough understanding of GAAP and applicable healthcare regulations. Professionals must critically evaluate the information presented, identify any potential for misinterpretation, and ensure that all disclosures are complete and accurate. When faced with challenging financial data, the ethical imperative is to present the facts transparently, providing context and explanations as necessary, rather than altering or withholding information. Consulting with legal counsel or senior management for guidance on complex disclosure issues is also a prudent step. Question 19. Strategic planning requires the Chief Financial Officer, CFO, to evaluate the organization's revenue cycle performance. Given the current economic climate and pressure to improve financial outcomes, Which of the following approaches to revenue cycle management best aligns with the Certified Revenue Cycle Professional (CRCP) framework and ethical considerations for patient access and financial stewardship? Option A. Offer substantial, across-the-board discounts on all outstanding patient balances to quickly reduce the aged accounts receivable. Option B. Reduce staffing levels in patient registration, billing, and collections departments to decrease immediate operational expenses. Option C. Implement a comprehensive review of key performance indicators, KPIs such as denial rates, clean claim submission rates, and days in accounts receivable to identify systemic issues and opportunities for improvement across all revenue cycle functions. Option D. Significantly increase upfront patient copays and deductibles at the point of service to maximize immediate cash collections, regardless of patient ability to pay. Correct answer is C. Implement a comprehensive review of key performance indicators, KPIs such as denial rates, clean claim submission rates, and days in accounts receivable to identify systemic issues and opportunities for improvement across all revenue cycle functions. Explanation: this scenario is professionally challenging because it requires balancing the immediate financial pressures of a healthcare organization with the long-term strategic imperative of maintaining patient access and satisfaction, all while adhering to stringent regulatory frameworks governing revenue cycle operations. The Chief Financial Officer, CFO, must make a decision that impacts multiple stakeholders, including patients, payers, and the organization's financial health, necessitating careful judgment. The correct approach represents best professional practice because it prioritizes a comprehensive review of revenue cycle metrics that directly influence patient access and financial outcomes, aligning with the Certified Revenue Cycle Professional (CRCP). Exams focus on operational efficiency and regulatory compliance. By focusing on metrics like denial rates, clean claim submission rates, and days in accounts receivable, the organization can identify systemic issues that hinder both revenue collection and patient experience. This proactive approach ensures that improvements are data-driven and sustainable, ultimately supporting the organization's mission and financial viability without compromising patient care or violating payer agreements. This aligns with the ethical obligation to manage resources responsibly while serving the patient population. An incorrect approach that focuses solely on increasing upfront patient collections without assessing the impact on patient access or affordability would be professionally unacceptable. This could lead to patients delaying or foregoing necessary care, potentially violating ethical principles of patient advocacy and access to care. It also risks increasing bad debt if patients are unable to meet unrealistic upfront demands, and could lead to payer denials if pre-authorization or eligibility verification processes are bypassed in the rush to collect. Furthermore, such an approach might inadvertently violate payer contracts that prohibit certain collection practices or require specific patient notification protocols. Another incorrect approach that involves reducing staff in critical pre-service and post-service revenue cycle functions to cut immediate costs would be detrimental. This would likely lead to an increase in errors, longer processing times, and a higher volume of denied claims, ultimately increasing operational costs and negatively impacting revenue. This failure to invest in adequate staffing for essential functions demonstrates poor financial stewardship and a disregard for the operational integrity of the revenue cycle, potentially leading to non-compliance with payer requirements for timely claim submission and follow-up. Finally, an approach that prioritizes the reduction of aged accounts receivable by offering indiscriminate, deep discounts on outstanding patient balances without a clear strategy or analysis of the underlying causes of the aging would be flawed. While it might reduce the AR balance, it could significantly impact revenue realization and set a precedent for future collections, potentially leading to accusations of unfair collection practices or a failure to adhere to contractual payment terms with payers. This approach lacks strategic depth and could undermine the organization's long-term financial stability and its ability to collect appropriate reimbursement. Professionals should employ a decision-making framework that begins with understanding the organization's strategic goals and current financial position. This should be followed by a thorough analysis of key revenue cycle metrics, identifying areas of underperformance and their root causes. The next step involves evaluating potential solutions, considering their impact on all stakeholders, regulatory compliance, and ethical considerations. Finally, A data-driven decision should be made, with a plan for implementation, monitoring, and continuous improvement, ensuring that all actions are aligned with best practices and regulatory requirements. Question 20. Examination of the data shows a significant number of patients presenting with high deductibles and co-insurance amounts under their Affordable Care Act, ACA, marketplace plans, leading to substantial patient financial responsibility. In optimizing the revenue cycle process for these patients, which of the following actions best aligns with both ACA compliance and efficient revenue collection? Option A. Advise patients that their ACA marketplace plan is insufficient to cover services and encourage them to seek alternative, more comprehensive insurance options before receiving care. Option B. Delay all billing and follow-up until the patient can provide definitive proof of their final ACA subsidy determination, which can take several weeks. Option C. Proactively verify patient eligibility for ACA subsidies and explore payment plan options or financial assistance programs based on their confirmed financial responsibility after accounting for subsidies. Option D. Bill the patient for the full estimated cost of services upfront, assuming their high deductible and co-insurance represent their total obligation, regardless of potential ACA-related financial assistance. The correct answer is C. Proactively verify patient eligibility for ACA subsidies and explore payment plan options or financial assistance programs based on their confirmed financial responsibility after accounting for subsidies. Explanation. This scenario presents a professional challenge because it requires a revenue cycle professional to navigate the complexities of the Affordable Care Act, ACA, in relation to patient financial responsibility and provider compliance. The core difficulty lies in accurately determining a patient's eligibility for ACA-related subsidies or programs, which directly impacts the amount the provider can bill the patient versus the amount that may be covered by government programs or tax credits. Misinterpreting these regulations can lead to incorrect patient billing, potential compliance violations, and financial losses for both the patient and the provider. Careful judgment is required to ensure accurate financial counseling and billing practices. The correct approach represents best professional practice because it prioritizes accurate patient financial assessment and adherence to ACA provisions. By verifying eligibility for ACA marketplace plans and understanding the implications of subsidies, the revenue cycle professional ensures that the patient is billed appropriately according to their determined financial responsibility. This aligns with the ACA's intent to expand health insurance coverage and manage costs. Furthermore, it upholds ethical obligations to provide transparent and accurate financial information to patients, preventing undue financial burden and promoting patient trust. This approach also minimizes the risk of compliance issues related to improper billing or misrepresentation of coverage. An incorrect approach that focuses solely on collecting the full estimated cost of services without verifying ACA eligibility fails to acknowledge the patient's potential entitlement to subsidies or financial assistance under the ACA. This is a regulatory failure, as it bypasses the ACA's framework for affordability and could lead to patients being billed amounts they are not legally obligated to pay due to subsidies. Ethically, it is deceptive and places an unfair financial burden on the patient. Another incorrect approach that assumes all uninsured patients are ineligible for ACA subsidies is also a regulatory failure. The ACA provides pathways for individuals to obtain coverage and financial assistance even if they are uninsured at the point of service. Failing to explore these options means the provider may not be pursuing all available avenues for reimbursement, and the patient may be incorrectly held responsible for the full cost. Finally, an incorrect approach that delays billing until ACA eligibility is definitively confirmed, without any interim financial counseling or estimation, can lead to operational inefficiencies and patient dissatisfaction. While accuracy is paramount, a complete lack of proactive financial communication can create uncertainty for the patient and strain provider resources. This approach, while not directly violating ACA regulations, represents poor process optimization and patient service. Professionals should employ a decision-making framework that begins with understanding the patient's insurance status. For those with ACA marketplace plans, the next step is to verify their specific plan details and any applicable subsidies. This involves utilizing eligibility verification tools and consulting ACA guidelines. For uninsured patients, The process should include exploring potential ACA eligibility pathways, such as enrollment periods or special circumstances. Throughout this process, clear and transparent communication with the patient regarding their estimated financial responsibility is crucial. If there is uncertainty, it is best practice to err on the side of caution and provide the patient with information about potential assistance, while also pursuing all legitimate avenues for provider reimbursement.